All right. Well, thanks everybody for that great conversation and patient. So moving along to our next speaker, we have Swapna Kakani back. And I did mention to her earlier that I shared her TED Talks with you this morning. So, a little bit more about that. And she has a lot of exciting things to share with us today too, about how to use the social media and different media and how it's effective, and to do the advocacy work that we're all involved with. And it's even more pertinent with the last year or two, what we're all going through. Everything is virtual. Everything is using all this electronic equipment, like Craig said earlier about the broadband issue. But even if we have broadband available to us, it's like, how do we access it? How do we make it work for us? So with that, Swapna, we'll let you get started.
Okay. Linda, do you want me to go through some of the slides? I just have a couple, and then do some live sharing.
Yes, that would be great.
Okay. So good morning and hi again. Seen you not even in the last 24 hours, I think. It hasn't even been 24 hours. So I hope everyone had a good night and are having a good morning. I have a couple of slides to talk about how to use media, and we'll define what that really means. Really, as your friend, a lot of people see it and can perceive it as an enemy, misinformation, everything you've probably heard about it in the news. But there's a way to use it really as a tool, especially when it comes to advocacy, and especially in the last 2 years, where we as individuals cannot physically be present where we want our voice to be heard, but that does not mean our voice needs to be silent by any means. There's a lot of tools out there to continue to allow us to use our voice pretty consistently and with strength. So I'm gonna slideshow so you guys know who I am. My name is Swapna, and I founded and now direct Alabama Rare. So first I wanted to go over the types of media, because when I was putting this together, I thought, I think I'm kind of biased of what I think is media. And I came up with my list without looking up anything, and then started looking up and realized, oh my gosh, there's so many types of media that we can use to get our voice and message broadcasted and louder. I tend to right now at least use social media the most, but there's also newspapers. Some people still get the actual newspapers to their homes. Some read it online. Of course, there's magazines, books, but there's also billboards when you're driving around. And then there's all the formats online. You can do articles, blogs. You can have your own website. You can have your organization's website. You can have a website just for the cause. Podcasts. You can get on other people's podcasts. You can start your own podcast. I mean, the options are really limitless right now. Radio, there's movies about rare diseases. There's a movie about the disability activism journey, Crip Camp, which was a great movie. I mean, it's really, we could talk hours just on types of media and how they've been used for advocacy. So just wanted to remind you that there's so many options, and never feel like you're stuck, or maybe you don't know how to use Facebook, or you don't know how to use Twitter. That's okay. There is a medium out there for you that we can adapt for you, or you can adapt to it. I made this diagram to explain what I'm about to explain, so with media, I think there's active engagement and passive engagement, and maybe passive is not even the best word, but what I mean by passive engagement is there's a part of media where we read it, observe it, listen to it, hear it. We use it to garner knowledge, to increase our ability to know about the topic. Yesterday, if you remember, one of my strategies was research your resources. So one way to do that is through media. The topics that are being posted by our elected leaders, articles that are coming out on the topic that you care about. Veronica talked about inclusive community. I care about medical nutrition, newborn screening. These are topics that are not being talked about in silos. They are being talked about across the country, and different articles are available. Different people have posted about it. There's been other bills about it. So how are you learning about that topic and engaging yourself in that topic more passively because it's there and then you can read or watch or etc. Whereas active engagement, I look at it as you are actually coordinating a news interview, or you're writing the post about the topic, or you're doing a call to action to the legislator, or even tweeting directly to the legislator. And we'll show some examples of each. So that's why I feel like they all work hand in hand like a gear. So where do you start? And so in terms of engaging with the media, and this could be viewed as maybe a more passive engagement, but still the first step and necessary is follow the elected leaders. And then this is catered towards federal leaders, but also works with state leaders. Most of our elected leaders, both at the federal level and at the state level, our governors, lieutenant governors, city council members, they all have social media. And they have social media just for the same reason why they have an email and a phone number. This is another way you can get in touch with them, but it's also another way for them to get their message across to their constituents. Follow hashtags. So a hashtag is, how do I define a hashtag? So a hashtag is a phrase, a sentence, a word that represents a stream of topics on that phrase. So if you put that, like what I just wrote here, hashtag AL politics in the Facebook search bar or in the Twitter search bar, even in the Google search bar, you will get information that is relevant to Alabama politics. And so you will get journalists that cover that topic. You'll get probably a lot of elected leaders who are talking about the topic, and you'll quickly see who are the figures that you probably should follow to get the most up-to-date information. Observe, learn from what they are posting. And then don't feel pressured and stressed to have to use every media and medium out there. Use the one that you're most comfortable with. And if that's Facebook, then that's Facebook. That's great. For me, I am using Facebook, Twitter, and Instagram, and LinkedIn, that's far more than I can even handle. And I refuse to get on TikTok because I just don't have the bandwidth, but I also do not want to get addicted to another social media platform. But you know your boundaries, you know what you're comfortable with, you know what you're able to handle. And so whatever works for you is fine. I do want to remind you the medium you do choose, if it's really catered to a legislative issue or some type of messaging, think about where the community who is affected by that issue lives. Do they live on Instagram? Do they live on Facebook? Do they live on Twitter? So explain a little bit, just at least on those three social media tools, because they are different. Facebook, you'll probably see an older audience. The teenagers and maybe early 20s are now not so much on Facebook, more so they're on Instagram and TikTok. And then legislators, elected leaders, they're on Facebook and they're on Twitter, but you probably will not see as many young individuals on Twitter talking about legislative issues or the community that's affected by the issue on Twitter. You usually will see professionals on Twitter. And then also, what is the medium where you can connect with your elected leaders? Your elected leaders will have social media most likely on all three. because again, they're trying to reach all of their constituents. I know that majority of our federal leaders, our congressmen, senators, and our governors have social media on Facebook and Instagram and Twitter. So for example, I'm going to use the topic of medical nutrition equity. So the coverage of medical nutrition. Most of the families affected by medical nutrition are on Facebook. They're not on Instagram, they're on Facebook. And a lot of them are actually not even on Facebook. They get through them through email. So when I am talking about that issue, I make sure to post something on Facebook and try to get it out through our newsletter. But when I want to maybe do a follow-up with an elected leader, I may post the follow-up on Twitter. So it does depend on the medium, but again, stick with what you're comfortable with. So what are examples of active engagement, and how do you go about thinking on how to get your message across and you be the initiator? So one, we want you to think about, well, what's the message? What do you want the message to be, and what's the message to get the best impact? I'll do another example. For newborn screening, for example, we want to say, well, this many babies are not are missing a diagnosis that can affect their life for the long run, or getting diagnosis now can affect saved dollars in the long run on disease management. Shaping the message to really attract the audience. Well, who's the audience? For newborn screening, it is our elected leaders. But in some cases, if we want to do an educational campaign, it may be families who have been affected by newborn screening, families of young children who are mothers who are pregnant who will be getting newborn screening. So you have to choose the audience, or it could be Alabama Department of Public Health, our program that does newborn screening. So with every issue, there's usually a lot of different people you can target. And do you want to target all of them, or do you want to target a subset? You want to choose who's going to talk about that issue, or to get that message across. That could be you in this program. That could be maybe you're the organizer, but there's a parent or an individual, a parent of a loved one who's affected by the issue, or the person who's affected by the issue, who's the best person. And usually it is the person who's affected most that is best chosen to speak if they feel comfortable. But take the time to prepare them. It can be nerve-wracking, but with more preparation, they can feel at peace a little more. Sometimes when you want to get attention from, let's say, the news stations, you can find their emails on their websites and send a press release. And I have an example of a press release down in the following slide, which summarizes what you're talking about and why you want them to cover it. You don't even have to go that far. You can write a post. You can write a post on Facebook explaining what your cause is about, or what the issue is, what is the message. You can make a video. Whatever you decide to do, think about your audience. If it's the legislators, what are the outlets and media that they're looking at as a legislator in their own district? Other opportunities to actively engage, and these are different mediums. These are through newspapers or publications, such as an op-ed. So it's an editorial, but usually by an individual affected by the legislation, that would be published in the editorial section. But be prepared that most likely they may publish the other side of the argument. You could do a letter to the editor, which is even a more concise article, maybe a couple hundred, maybe 200 words. And then even with active engagement, always be ready to be a resource, to share information regularly about the legislative issue or updates about what you're doing to create an inclusive community, or what we're doing to increase newborn screening, or what we're doing to make medical nutrition equitable in the state, equitable access in the state. And then you can also use social media as follow-up. Let's say you just met with Representative Adderholt's office and you want to say thank you for meeting with them, and you took a picture. Always remember to take a picture. And you took a picture with the office staff and maybe Representative Adderholt. You can post that picture and say thank you for a wonderful meeting, and you can post it on your Facebook page. And so I will give you some examples of all of this. So the bottom left is I'm being a resource. So I was listening to a webinar put on by one of the national organizations. If you remember yesterday, one of my strategies was connect with national organizations if you have them, and research your resources. So they were giving a whole webinar on newborn screening. So I was allowed to take a screenshot of this slide, and it was a quick way to give information to my followers on newborn screening. And by doing a hashtag, I can create an archive of information just for newborn screening that I can then relay back to our legislators. We are in a coalition to expand Medicaid in the state. So again, this is another webinar that I was listening to and trying to spread word about the facts about Medicaid expansion in our state. Representative Terry Sewell actually co-sponsored and supported one of the bills at the federal level, and I wanted to say thank you. So this is actually a previous picture, an old picture with myself and Representative Terry Sewell. So I posted that picture and said thank you for sponsoring, and did hashtags that would then connect it to the topic. Alabama Rare partnered with another organization to meet our federal representatives when they're in district, when they're back here in Alabama. So we posted the pictures of the meetings, and you'll see some people are meeting with the representative. At the top right is Representative Brooks, but then some people are meeting with staffers, which is very common. Again, if you remember yesterday, staffers are as important as the representative when you're meeting at their office. So this is an example of doing a news story for our local, in Huntsville, Alabama, our local Channel 48, WAFF. So this was our first State House Advocacy Day in Montgomery, and I sent out a press release to WAFF to cover our lobby day. And because Rare Disease Day is February 28th, they covered it that morning before we went down to Montgomery. And so in the center picture, this is Miles. At the time, he was just in high school, maybe even that. And he had never been on the news, but he has a rare disease and was very passionate about what we were doing. And so I prepped him a little bit beforehand. This is his mentor, and both of them came on camera to talk about the importance of rare disease advocacy. Down on the bottom left, I have no connections to the Montgomery channel, but another one of our advocates does, and he got us on the news a couple days before our State House Advocacy Day in recognition of Rare Disease Day. And then the top right, I posted this part of the interview, but I'm at another person's house. I'm at another family's house who's also affected by short bowel syndrome, and I made sure their story was told, not my story. I made sure their story was told, and that how medical nutrition was affecting them, and how that policy affects them particularly because they live in Alabama and the policy is not available here in Alabama. So I used my connections, but got another family to have their voice be highlighted. And that's really what I love to do, is being able to get other people's voices highlighted through our work. And there's definitely ways to do that by coordinating the interview, but making sure you have the support around you that can also articulate on camera. So this is an example of a billboard. I never thought we would be able to put a billboard up, but as I said yesterday, work with what you have. So a physician came to me. He's a family friend as well as a physician in Huntsville. He loves to run marathons. His goal is to run I don't know how many there are, but all of the global marathons, famous global marathons, and one of them is Boston. And we turned it into a fundraiser in partnership with the National Organization for Rare Disorders. So the goal was to raise money. That money did not go to Alabama Rare, it went to NORD. But we thought, well, we have an opportunity to raise awareness about rare disease in the state, given that this doctor works in Huntsville and takes care of patients with rare diseases. So I called up my friends from college who are good at graphics and told them what I'm thinking to put on there. And they made this billboard. He called the hospital and said, hey, can we borrow your billboard for one day while I run the marathon in Boston? So they put it up, and on the same day that he was running the Boston Marathon. And people stopped and took a picture, and we were able to get a unique opportunity of awareness. Then this is a press conference. If you remember yesterday, I showed pictures of us signing a bill with Governor Ivey, making February 28th and Rare Disease Day from here on out, and February as Rare Disease Awareness Month from here on out. And I brought the microphone, I brought the speakers, I brought everything. There was nothing there to be able to host what I called a press conference. You may think there's tons of media on the other side of this picture, but the picture was taken in this exact angle for a reason. There was one person on the other side. I put a press release out, this media advisory on the right, trying to attract as many people as I could. But I did something that technically I learned at that time that you shouldn't necessarily always do, and that is to invite everybody. You should try to target your press releases to some news stations if you have contacts. But I wanted to go big or go home, and we got one person to come out. And however, we still technically had a press conference. We were still able to get our message across. We were still able to do a public signing with the governor. And the point of this, again, was first and foremost to show that we have unity around rare disease in the state and that you should never feel alone. And then this is another type of press release where this is a press release for an event. It explains the week of activities for Rare Disease Week. And so with a press release, and we can talk about that, or you can email me on details of how to write a press release, but it's really summarizing what you're doing, why you're doing it, and a personal quote of why this is important to you. So with that, I'm going to use the extra time to go online and share. If I can, sorry. To stop sharing. Share specific resources or specific examples on our own websites and Facebook pages. And I want this to be an open discussion. So first, are there any questions about using social media as a tool for legislative advocacy? And we can go from there.
This is Jenny Lux.
Yes, hey Jenny.
Hey, I had a question. I noticed you listed most all of the social medias except LinkedIn. What is your feeling on that?
Oh, did I not link? That's just a mistake. I thought I did list LinkedIn.
I thought you listed LinkedIn.
Yeah, LinkedIn was there.
I apologize. I'm sorry.
That's okay. LinkedIn was there. I do. So LinkedIn is also, usually you'll see more professionals on LinkedIn, but more and more I'm seeing more advocates on LinkedIn and sharing content about their legislative issue or their topic of concern. A lot of times with LinkedIn, I feel like it's easier to share other organizations' content as it relates to that legislative issue. And it's always good with LinkedIn when you do share something to try to add your own perspective on it. So Linda, I'm going to have you guide me here. Do you want me to go to the Facebook page first?
Sure, that's fine. Just you can kind of go through the list and show them all.
Okay, so let me share this first.
That's not something that we've really discussed as a group on who uses which social media. I'm
Okay.
assuming that everybody does a little bit of each. So, you know, the highlights of all of them, I think, would be helpful.
Mm-hmm.
Because everybody uses it differently. Like I use mine different than you use yours. So
Right. So this is the Alabama Rares Facebook page, and so it's somewhat active. I have a small team, so I wear a lot of hats, and it's hard to regularly post as I would like to. But this is our post from Rare Disease Day. So we partnered with a pharmaceutical company in Birmingham-based pharmaceutical company that is developing drugs for the rare disease population. And together with them, they lit up places in Birmingham in Rare Disease Day colors. So this is the Homewood City Hall. So Alabama Rare put a message out to some of our network to join us on that Monday evening and do a tour of all the sites. And then BioCris brought out a bus, and we joined them and did a bus tour of some of these sites. So this is the Finley Center, if you're familiar with Birmingham. This is the Regents Field. This is Miles. He was the same boy from that other picture. He's now a freshman at Samford, if you can imagine, or maybe even a sophomore, if you can imagine how much older he is now. This is the South Point Bank off of 280. So this is an entire group that came out, both the BioCris employees as well as our families, some of our families. So let me, so one purpose of, if I can go back. Sorry. There we go. One purpose of our page is to show what we're doing as a community. And that was why we posted about this. Here's some of the.
Do you want to go to the hashtag too, so they can see how the hashtags work?
Oh yeah. So let me do Rare Disease Day. So yeah. So by clicking on the hashtag Rare Disease Day, 49,000 people are posting about Rare Disease Day. So then you now go from just you posting about something to posting with tons of other people. So naturally your content gets more awareness. And then you can click on the hashtag and see what other people are posting about Rare Disease Day. It's a great way to see other people's posts, even meet other people, or maybe even find other people with your own disease or the same issue you're concerned about. So Love to Breathe, this is a great example. I've met her years ago. I haven't even met her in person, but I follow her on social media and love a lot of her content. Just as a fellow young adult woman, also with a rare disease from birth, she has cystic fibrosis, but I've learned a lot about advocacy, even just following her. I learn a lot by observing others. You know, I didn't take any formal social media course, or part of it is the age that I am, that I grew up in some of the social media, but even that, I'm a little older than maybe some of the 20-year-olds that are really involved in it. But truly, I just started studying social media and studying other people that are my age, young adult women who are advocating and how they're doing it. And what I've learned is that it's a form of storytelling, especially on more on Facebook and Instagram. But people are telling their story, and if you can narrate what is probably the hardest thing to do is narrate a legislative issue as a story and really capture like how this issue is really affecting you day in and day out. So this is the National Organization for Rare Disorders. They're posting about what they're doing for Rare Disease Day. There's an account just for Rare Disease Day. So things like that. Let's see what else I can show you. So we've also posted about our event, our Rare Disease Symposium. I think I posted mainly on Instagram, but I'll show you. Here we go. So here's our Rare Disease Day Symposium. So I tagged the other organizations that we're working with, because then they'll get notified that this post is up and they can also share it. And then I used hashtags that are common for Rare Disease Day and rare diseases. Let's see. So this is an example of a video as an advocacy tool. So Brooke Thomas, my co-lead for Alabama Rare, she has 3 children with MPS 1, and her oldest and her were interviewed at their hospital in Minnesota when they were getting subspecialty treatment. So I shared the video and kind of told the story through my words, but it was enhanced by just the interview that they did.
And I follow Swapna and a lot of Alabama Rare, and I watched the video too. So yeah, it's a great way to keep up with everything, with other things going on.
Mm-hmm.
I had a quick question.
Yeah.
Sometimes I have trouble when you type in on Facebook and you want to link like a hospital to their hospital page, but it doesn't highlight it. How do you get it to highlight?
Okay, let's do it right now. If it doesn't highlight, there is a chance that they won't let you tag. Some organizations don't let you tag them. So like UAB and Children's, I believe we're both following each other. So that is why, but let me see if I can, because I don't think I was able to tag Minnesota Children's. So okay, I'm trying to find Minnesota Children's, and which is the hospital Brooke Thomas went to with her son. And you may not find it. They may. So Children's of Minnesota. So this is what. Okay, never mind. That worked. So you type different iterations of the hospital to try to find it, because it's not always labeled as what you think it is. Like it wasn't under Minnesota Children's. So for Children's of Alabama, that came up quickly. UAB, there's a lot. This is just going to be the general UAB, but if I want UAB Medicine, who I'm actually partnering with, then I would put UAB Medicine. So medicine came up. Is there a specific example, Jenny?
I didn't realize that it was based on what the page was named. And I didn't realize that I needed the @ symbol. So.
Oh, okay, there we go. Yeah, you have to have the @ symbol. And that's for anything. Even if these are my friends, even if I tag them, then they pop up, but you have to do the @ symbol. If I wanted to
explains it.
Oh, okay. Let's say if I wanted to tag the National Organization for Rare Disorders, I usually start with rare disorders, because that, you can see that sometimes it takes a second. Because if you think about it, there's so many national organizations. So I try to find the words that are more rare instead of the words that are more common, so that it'll come up in the list faster.
Okay.
Yeah, that's how you do that.
Thank you so much.
Mm-hmm. And then a hashtag is shift number 3, and you get a hashtag.
Right.
And then you type, and then you space, and it's already selected, and it'll be blue when you post it.
Okay.
on Instagram, I don't know if you can do it on Facebook, but on Instagram, you can, when you search a hashtag, you can see, let's see if we can do it here. You can see how many people are talking about that hashtag, and you prefer to use the phrase that has the highest number. So I know rare diseases has a higher number compared to rare disease. That's why I always do hashtag rare diseases.
Okay.
Just a kind of a tip. But it's not showing it here on Facebook, but on Instagram you can do that. What? Is there another? I can go to Instagram to show you kind of an example of storytelling. Let's see.
This is very helpful to see you do it live like this. Like Jenny said, like, how do you tag somebody in there? It's like it sounds so easy, and after you've done it for a couple of years, it's you just go right to it. But for us
Yeah, of course.
to do that, and even like the hashtag, it's just like where it is on your keyboard, you push it in and do it, and then.
Yeah, I'm happy to explain.
Yeah.
And like, please ask me questions, because I do. Sometimes now that I've done it for a while, I do forget that I did have to learn those buttons myself. So this is an example of a video that I did with Linda and her daughter, Frances. So when it was ready to be live last year, I had to figure out, how do we share it? We could just share the link. It's a YouTube link, but how do we get people's attention? So one thing I'm learning and kind of testing out is just, some people do caps on certain things. So because I had been posting about pretty similar things, and this is very unique that I did, I said a new resource, because what I was posting about was a resource versus me on the beach or something, because this is my personal page as well. This is my advocacy page as well as my personal page. And then really to tell people how long we've been working on it. It was a lengthy effort, and Frances and I had spent a lot of time on it and really wanted people to appreciate the hard work that went into it. And then explain who Frances is. Again, we're tagging, same thing, @, and then the name of the organization. Something to note though, these names are different than they are on Facebook. So you have to know what they are on Instagram versus what they are on Facebook. But same thing, once you start typing, and I can create a new post and show you in a second. Once you start typing, they'll come up. So like Pediatric Pulmonary Centers, that wasn't an organization to tag, and that's okay.
We do have a Facebook page.
Okay, you guys do have a Facebook page. And so what did we do? And so I tried to explain it as best as I could in layman terms. Always think about 5th grade reading level or even less, to really, you don't want to make anything too complicated. Really try to make it as simple as possible when explaining. Remember, you're the educator, you're the trainer, you're teaching the community. So, and I always try to say thank you to the organizations that were involved and that were included in the video, if possible. And then posted the link. So with Instagram, what is kind of annoying is, so you'll see these links are YouTube links, and they don't have any hyperlink. If you notice, they're not blue. Like, I can't click on it and it will go anywhere. So Instagram has this feature that you cannot put links on the caption, like this is a caption, and it'll go anywhere. Instead, the only way to link a post to a video is to put it in your profile. So you go to your profile. There we go. and you can edit this edit profile, and you can always edit this website. So right now, like I have a talk on Tuesday, and I'm trying to get people to register for it. So that's where that link is going to. But so I'm always editing that link. Now, when you get a lot of followers and you're like a celebrity, there's a way you can link a post directly to a video, or you can swipe up. I mean, it's a whole nother thing. There's a lot more features that Instagram that is beyond my own scope and knowledge. But when getting started, unfortunately, you have any link that you want to associate with a post, you have to put it on your right here on your website under your profile. Okay, here I was gonna start one. So create a new post. So see, Instagram, it's all photos. It's all photos. You have to narrate through photos. So I will do this one, this billboard. Doesn't look great, but that's okay. Okay, so just like before, like at symbol, then I'm typing in children's, and there we go. They come up, and I just click on it or hit enter. And same thing, hashtag. I can do rare is not rare. I can do rare diseases. Oh, here, I'll show you rare diseases. So rare diseases, 73,204 posts. Compared to rare disease days is less, rare diseases run. And then if I showed you rare disease, it's even less, right? No, sorry, rare disease is even more. So you could do rare disease, or you could do rare disease day. You could do all three. You could do as many as you want, really. Are there any questions about that? I can.
Oh, sorry. Was someone else talking?
Oh, I was going to say one more thing. I just thought of something. So another thing about Instagram is like, so I could do all this, and there's no, if I put enter, it doesn't actually enter, meaning there is no space. So if I want to actually break my paragraphs out, I'm going to delete all this. I actually write in my notes section. I'll try to give you an example. So this right here. So how there's a break right here. Usually when you're writing directly into Instagram, all this will be just one block of text, and it can be hard to read. So if you want to break in your text, and maybe you want that even to be more effective in the way you're writing, I actually write on a Word document, or write it on the Notes app on my phone, and do the breaks and then copy and paste into here. And I know that's extra work, but just a tip of the trade that I learned really late into Instagram.
I was just wondering though, when you're typing up, like you're in the middle of typing up rare diseases, and it pulls down like a drop down list, can you click on multiple ones and just install them that way?
Oh, no, you gotta click on one at a time.
Well, I guess that's what I meant. I apologize. So, but after you click on one, does the list disappear?
Yes, I think
Okay.
so. So then, I mean, I'm searching it. That's not what you mean, but here I will, I'll go back. Great. Okay, so then, so the way I know now what you're asking. So, okay, I did hashtag and I typed rare diseases, okay? Then you'll still see this list, right?
Right.
I just hit the space bar and it did go away. Yeah, you're right.
Okay.
But then hashtag again, and you just start typing again, and it'll start coming back up.
Okay.
So every time you do hit the space bar or enter, it will go away. But just hashtag and start typing again. Care about rare is another one. they'll come up. And how I even knew about these hashtags is I was looking at other people's posts, going to the national organizations' posts, going to other advocates' posts. What are they posting about? See, especially individuals who have a lot of followers, who have a lot of traction. What are they posting hashtags? What are the hashtags that they're posting? That's how I've learned about them. You can even create some of your own. I mean, one family created their own for short bowel syndrome, and now it's a trending hashtag, and it's short gut, so what? And it's now a couple thousand. So that can also happen. Other questions or things you would like me to share? Does anyone
I
have
do. I do understand what the social media.
Sorry, go ahead. Say that again.
Oh yes, I do. I do understand social media. I have Facebook and Instagram. Because there are 2 social media I made.
Okay.
I only do like one hashtag and that's it.
Okay. And what hashtag is that?
I say hashtag read the Zoom because I made like make my own face mask
Okay, yeah.
because I want people to understand.
Okay. Yeah, I mean,
Because I've been working on it.
yeah. So one, I mean, as
like
I
hashtag read the Zoom.
free to, sorry, what is the hashtag free to
That'd be
Zoom?
very helpful.
Or can you type it in the chat?
Hashtag read the Zoom, like leave the room.
Oh, okay. So, as I said yesterday, start with what you have. So I think you're great with, it's okay with one hashtag, and especially it sounds like it's very targeted to what you're trying to get across. And that's good. So, I mean, with rare diseases, it's so broad. So we don't have that privilege of having something so specific. So when I'm talking about just my own disease, that's why I do the shortcut, so what, or SBS warrior. There's a lot more specific hashtags. I was really explaining hashtags just for the general sense of that is a way to get your message maybe seen beyond your own network that you have currently. And it's a way to expand your network when you're getting started. And to also acknowledge that there are hashtags out there, what the purpose of them are, things like that. But yes, it's totally fine to have that one hashtag. Seems like it's very targeted and unique and specific for what you're doing, and props for doing what you are doing on Facebook and Instagram. I'm seeing some comments in the chat, so let me see if I can answer. Thank you, Dr. McCauley. Okay, yeah. So with the billboard, so we are a small organization. We're not going to be able to afford a billboard. So that was a donation for that one day because that physician works at Huntsville Hospital, and Huntsville Hospital has their set of billboards across town. So they donated that one billboard for the use of the marathon. Now, the next year I asked again for Rare Disease Day, and they did not offer it for free. They said I would have to pay. So you can use what you can get. That was a unique opportunity. Otherwise, I don't know. It'll be a couple $1,000s for a billboard, I believe. And they coordinated everything. We just had to send the graphic to Huntsville Hospital marketing, and then they were able to put it up. Yeah, thank you for sharing that link. from Nord. And then I'm reading this other comment. No, this is a great question about what are we allowed to share, especially if other people are in the photo other than ourselves. So one, we get photo permission. If when possible, we get photo permission. And that's a lot looser now when like everybody's like, let's take a selfie and then it's immediately online in 2 seconds. But if you can practice that asking of permission at any time when a photo is taken, do it. Like, hey, do you mind if we share this on social media? And then their verbal consent is fine. In terms of personal information, things like that, that has to be asked. So there was a time where we did a campaign for Rare Disease Awareness Month where we posted short stories, vignettes about different people in our Alabama Rare family network about their rare disease story. Well, in part of them submitting their story and us editing it was a permission to post on Facebook. And they had to send a picture in that we would post, we would share the story. Now, we did not share, like they gave us a story. We said, we'll edit it and put your picture up. They did not see the final vignette before we posted. And that can also be in the consent that this raw material we are receiving, you own your story at any time. But this final copy we won't get a final approval before posting. And yeah, I would never, this applies to groups, Facebook groups, anything. I mean, any personal information, it is that person's to share their story. I mean, and that, even that vignette, that was their words that we made it more concise. I try not to ever put words in other people's mouths or try to speak for them. If anything, if we're speaking on behalf of a cause or speaking on behalf of a group, that's very general terms or quotes from exact quotes with quotation marks from family members, and then their names are by it or an anonymous. Even when I reshared Brooke Thomas and her son's video, and I quoted them from the video and I posted the video, I said, these are my favorite quotes from this video. And I put quotation marks. I rewatched the video 3 times so I could write it correctly, put quotation marks around the words, and wrote Brooke's name by it. I mean, do as much as you can to make this as authentic and integral as you need to. I mean, it's worth it in the end. Sharing, I think if anything's online, it can then now be shared. If it's on a public page, so with Facebook, you can put settings on what can and cannot be shared on private pages. If it's on a public page, it most likely can be shared. If it's in a group, not necessarily, it can not be shared. If it's in a private group, it usually cannot be shared. So I'd look into those settings. Does that answer that question? Any other?
Jenny had one more about if it's in caps or not. Is it 2 different? Would that be 2 different hashtags? And I guess that would just be looking it up to see if it goes to the same one.
Yeah, it usually goes to the same one. Capital letters don't matter usually. And that's a great idea. Allison said, have found asking realtors to use their billboard space for a day or 2 is highly effective. It's a write-off for them and a win for your cause or nonprofit. That's a really good idea.
Well, Swapna, I want to thank you so much for all this information. Been very helpful to me, and I know you had a lot of questions.
Yeah, of course. I'm always here to answer any questions. Happy to help. Thank you for having me.
I did try and take a screenshot while you were talking.
No, thanks.
I forgot yesterday to take a few. So. So